So I'd like to tell you a story today. During my second year in college, I took a spring break trip to a beautiful country where I was recommended against drinking the water. This was my first international travel without adult supervision, and so I really wanted to embrace the identity of world traveler. And I didn't want to be that pretentious American who used bottled water to brush my teeth. So I drank the water. Inevitably, I became pretty ill. And I went to my university health center, and I told them I had just been in this beautiful country, I drank the water, and now I'm sick. And they said, well, what's most likely happening is you have a stomach flu, you have a bug, just go on a liquid diet, you'll be fine. And I said, no, you don't understand. I was just in this country, I drank the water, I'm feeling really ill. And they said, no, go on a liquid diet. So I did, and after losing about 15 pounds, I realized that chicken soup wasn't really soothing my stomach or my soul, and so I went back to that health center and I asked them to do some more tests. I'll not share the details of those tests with you right now, but once they did those tests, they gave me the diagnosis that I knew was there, although I didn't know the word for it at the time. When I heard that word, what it did for me was gave me a confirmation that what I was feeling that wasn't addressed with the word stomach flu or stomach bug, something else was there. So that word was Giardia. I won't go into details of what that is. But with that word, it let me feel like there was a word for this, there was a diagnosis, and I could move forward to a solution. And so I'm sharing this talk with you because even though I'm not the medical kind of Dr. Ellis, I did have the opportunity this past summer to give a kind of diagnosis or put words to an experience that, like Giardia, is not a good experience, but an experience that many people across this country have felt. So along with a team of researchers, this past summer, we identified that women are 50% more likely to switch out of the STEM pathway after taking Calculus 1 when controlling for intended major, reports of instruction, previous calculus experience, SAT or ACT scores, school, and professor. So that means that 50% more of the women who are taking Calc 1, planning to take Calc 2 because they want to be an engineer, they want to be a chemist, whatever, are leaving that after the experience of Calc 1 compared to the men. Now this isn't a groundbreaking finding, much like it wasn't so groundbreaking that I contracted Giardia after drinking water in a country for which I hadn't developed the proper immunities in my stomach. But like Giardia, just by giving the words to this experience, I got to help diagnose something that many people were feeling. Now, when I give this talk, or when I talk about these research findings across the country, inevitably, there will be some in the audience that says, well, what about race and ethnicity? Have you done similar analyses trying to understand the experience of race and ethnicity with or without gender? So maybe looking at the intersectional perspective too. And I say, well, that is a wonderful question. Unfortunately, there's such a low percentage of non-white students in our sample that we can't run the same statistical analyses to give the same strong, quantifiable results. And then the person in the audience, like some of you I'm seeing right now, nod your head in understandment. The person feels good because they asked the right question. I feel good because I gave the right answer. And then we move on. So this has happened for years. I've been presenting on this data for years and been giving these answers for years, and it's been fine. And it struck me that it was similar to when I went to the health center and said, I'm having these symptoms, and they said, most likely you just have a stomach flu, here's a remedy. And that remedy had no bearing. It didn't help me at all, because it wasn't what I was experiencing. That by not actually looking at the experiences of these students of color in our calculus classes, even though they're a smaller percentage, that we're making their experiences invisible, much like the doctors made my Giardia invisible by not testing for it. And so what we're doing is not understanding the actual experiences of these students in the same way that we can in order to provide a solution. So we have two problems here. We have the problem of diversity in STEM that we're all well aware of. It's being published all over and talked about in the news. But we also have the problem among researchers that when we write these findings, when we talk about them, when we answer these questions, we're not really looking deeper into what's happening with our answers. So although my answer has been accepted as correct, it is correct, it's accepted by the research community, it doesn't tell the full story. And so I was recommended to not just come up here and tell you some problems, but also try to understand some solutions. Now, certainly the problem of diversity in STEM and representation of women and students of color and persistence is not so easy to solve as the pill that they gave me to solve my Giardia. But we can think about ways to go about it by just trying to actually understand what's happening. So here we are, we're at Colorado School of Mines. Many of you are students, and so I understand that you probably get the situation that's going on here, but I'm just gonna share some numbers really quick. So Colorado School of Mines is almost entirely a STEM school. There's some economics majors, but we'll just group them into STEM for now. In 2014, there were about 900 students graduated with STEM degrees. Of those 900-ish students, around 25% were earned by women, less than 10% were earned by Hispanic and Latinx students, and less than 1% were earned by Black or African American students. So I imagine that the classes here at Colorado School of Mines, the calculus classes, which are feeding into these STEM majors, look fairly similar, if not even more homogeneous than the sample that I looked at in my study. And so what can you do as students, as faculty, as parents, whatever your relationship is to this university? As students, I want you to be asking more questions. I recommend that you think about, why do your classes look the way that they do? Or if you read research, try to understand, why is there too few students to be able to do a similar analysis? What's put in the footnote of multiple of my studies right now. And if you're in the position to be giving answers to people, which is a wonderful place to be in, I want you to question those answers that you're really comfortable giving. Because although they might be right, that might not be the full story. So we need to do better at looking into what's actually going on. So for me, this talk is a public coming out and acknowledging that when I gave that answer so many times, that I was missing the whole story. And I'm asking of you today to be curious, like we just heard in the past talk, ask more of those questions and question the answers that you're getting. Thank you.